March 4th has been declared World Obesity Day, and it is all about advocacy. Organizers say they want to raise awareness about the issue and brainstorm solutions to help reduce the global obesity rate. About 13% of the world is obese, but here in America, the number is more than 40%. So joining me now to talk all about it, our 9 News medical expert, Dr. Payal Kohli. So Dr. Kohli, what are the trends in obesity when it comes to the United States? That's a stark difference, 40% compared to 13% globally.
I mean, it's shocking, Sam. We're seeing this 40% number, and in 5 years, it's expected to grow to over 50%. And we're not just talking about adults, we're actually talking about our children as well. So in kids and adolescents, the rate of obesity is nearly 20% right now, and that's expected to grow as well. And I like to think about obesity like the first domino. So if you think about this domino, it causes the blood pressure, the diabetes, the sleep apnea, the heart disease, the cancer, every other domino to fall. So we really need to talk about this as a medical problem.
It's a great way to describe it because then you can visualize it, right? So why do you think here in America especially we are struggling with obesity? What are the factors that are at play?
Well, you know, we used to always think that it's a you problem. Like you get off the couch, you're eating too much, you're being too lazy, and it's a problem of the patient if they're struggling with obesity. Now we've realized it's actually a complex interplay of hormones, of behavior, of access to food. In fact, we've even realized that if you start cutting down your calories, your body tries to compensate by increasing your hunger hormones.
Really?
So it actually tricks you and prevents you from being able to lose that weight. So we've realized that obesity is a medical problem. It's not a patient problem, and we need to think about addressing it just like any other chronic disease.
And how, so two-part question. Number one, how is obesity defined, and how would someone know if they are obese?
Yep, so the way we currently define obesity, which I think is too narrow, we need to talk about that, is BMI, body mass index, which is your weight in kilograms divided by your height in meters squared. So I want every single person to calculate their BMI so that they know how obese they are. And there's different degrees of obesity. 30 to 35 is moderate, 35 to 40 is severe, and then over 40 is very severe. But I actually think we should go even a step farther because BMI doesn't take into account muscle mass or fat distribution. So there's now been new guidance for us to think about defining obesity based on our waist circumference. What is, you know, the width around our waist, and also based on a parameter called waist-hip ratio, as well as body fat versus lean muscle mass.
I like it's more complex, right? I think that makes sense. I'm not a doctor, but that makes sense. So why should we, in your opinion, get rid of the stigma, body shaming around obesity? I mean, that's definitely something that we've talked about over the last 5 years, especially.
You know, Sam, it's been going on too long. And I think it's a problem that's propagated itself. And obesity, unfortunately, is one of those medical diseases that you wear.
Right.
People can't see if you have hypertension or diabetes or high cholesterol, but they can tell if you're obese. So we've conflated that to mean that it's a judgment when somebody tells you you need to lose weight. And I think we really need to dissociate the two. We need to think about it like a chronic medical problem. The World Health Organization in 2013 called it a chronic disease, which really helps to sort of say, okay, this is a medical issue. This has nothing to do with how you look. It's not a judgment on you. And, you know, that's not just for patients, but for providers as well. Knock on that door. Because like I said, it's that first domino. So you really can't be treating patients holistically in 2025 without actually addressing their obesity. And the likelihood of, you know, 10 patients in your office, 4 of them are going to struggle with obesity. So I think this fat shaming, that we're body shaming or fat shaming people has to really be yesterday's news. And today we're talking about an empowerment.
Yes.
Yes. Getting our life back, getting our health back, having less joint pain, less cancer, less heart disease, and feeling better.
Yeah, seeing it for what it is as a disease. I like that. And then finally, what has been done here in America to address obesity as an actual medical problem, to what you just said earlier?
You know, in the last decade, we've made tremendous strides. And like I said, it used to be just all a patient problem. Now we've got, obviously, behavioral counseling. We've got medications that work and don't just melt the weight off, they melt away the other chronic diseases, and they protect your organs like your kidneys and your heart. So, you know, tirzepatide and semaglutide, which are popular medicines, those are incredibly effective. And then we still use bariatric surgery, which is gastric bypass surgery in those very extreme cases. But don't be shy to talk to your doctor about obesity. Please open that door because you have so many options today, and it's not a you problem. We're in it together.
I love that, Dr. Kohli. Thank you so much.